Yeah.
a report recently that 4 states in India, including Tamil Nadu and a few others, had reported a very big underestimation in death rates.
Yes.
That
Yes.
they had reported that there were 500,000 excess deaths, which have then probably not been properly
But
estimated.
that sounds implausible. I have been seeing the reports. So, if the deaths reported for a particular month are 2,500 last year, this time the deaths reported maybe 4,000. The deaths are 4,000, 4,500. And then if you take unreported deaths, that's reported to other causes, it may be double that. So 2,500 could become 5,000, or could become 10, but it's not as much as that. No. To the best of my understanding, there is underreporting of deaths, and there is underreporting of cases, particularly in rural India, where people do not actually get tests done, do not get to hospital. But it is not as large as what you said. 500,000 is a large number. The official number for deaths is 379,000. So it could well be that it is 480,000 or whatever, something like that, in that range nationwide. But I don't believe in these states it could be that much.
Okay.
I welcome you all to the first panel discussion session of second SANIM International Development Conference, SIDC 2021 on COVID-19 recovery, context and priorities. I'm extremely delighted to have in this panel 2 eminent economists from this region, Professor Rehman Sohan and Professor Deepak Nair. Professor Rehman Sohan, and especially, I don't have to spend words about these 2 eminent personalities. But just to put on record, I have to say a few words. Professor Rehman Sohan is a noted Bangladeshi economist and freedom fighter who played an active role in the Bengali national movement. He is currently the chairman of Center for Policy Dialogue, Dhaka, Bangladesh. He was one of the several economists whose ideas influenced the 6-point program of Bangabandhu Sheikh Mujibur Rahman, which became the basis for the struggle for self-rule for Bangladesh. A former professor of economics at Dhaka University, he has authored numerous books and articles on various development issues. The most recent of these, Untranquil Recollections, Nation Building in Post-Liberation Bangladesh, it's been published by SAGE in February 2021. It's a very recent book by Sir. Professor Deepak Nair is Emeritus Professor of Economics at Jawaharlal Nehru University, New Delhi. He was Distinguished University Professor of Economics at the New School for Social Research, New York, and was Professor of Economics at the Jawaharlal Nehru University, New Delhi. He also taught at the University of Oxford, the University of Sussex, and the Indian Institute of Management, Calcutta. He was Vice Chancellor of the University of Delhi from 2000 to 2005. His research interests are primarily in the areas of international economics, macroeconomics, development economics, and economic history. His most recent work is on the remarkable economic transformation and rise of Asia during the past 50 years. So this session is about COVID-19 context and priorities, the South Asian perspective. We have a lot of expectation from these 2 eminent panelists, but just to very briefly, I thought to set a little bit of the tone of the discussion today. What we have witnessed that during the COVID, that there are broadly 3 types of crisis: health crisis, economic crisis, and the social crisis. And I would like to pose 4 questions just to stimulate discussion. So first one is that, do we, and I mean the governments of the South Asian countries, have a good understanding of the impacts of this crisis? Second, based on the understanding whatever we have, and especially the governments of these of this region, of these countries, whether we have been able to set our priorities right so far. Third, what are the major lessons we have learned so far from this crisis and the handling of the crisis? And fourth, what needs to be done for the recoveries in the health, economic, and social sectors in the country? So I'm quite sure, despite the fact that Professor Deepak Nair is from India and Professor Raymond Sovan is from Bangladesh, but actually they don't have any country boundary. They are actually South Asian and more of Asian. So they will speak not only, about the country, but I think for the region and for the continent as well, and on some of the global issues as well. So with this, may I request Professor Deepak Nair to speak first, and then we'll request Professor Raymond Sovan to come next. Over to you, sir, Professor Deepak Nair.
Thank you very much, Salim, for the warm words of welcome. It's a privilege to be in your midst. I am not sure that I'm going to be able to address all the questions you have posed in the time we have available. Even so, I think I will address some part of what you have posed. In novel coronavirus emerged in Wuhan, China in late 2019, possibly from its wet markets by hopping across from animals to humans, or, as several scientists now argue, from its Institute of Virology lab by accident or otherwise. Be that as it may, the virus soon caught the highways and bylanes of globalization to quickly encircle and straddle the world as a pandemic. Over the past 18 months, it has turned the world and our lives upside down. The object of my presentation this evening is to focus on the COVID-19 crisis in South Asia, situating it in its wider global context, considering its social and economic impact, and reflecting on the future in terms of the possibilities and prospects of recovery. The structure of what I have to say is as follows. First, I will outline the dimensions and contours of the pandemic. Second, I will consider responses of governments and peoples in South Asia. Third, I will examine economic, social, and political implications and consequences of the pandemic. And in conclusion, while reflecting briefly on the future, I will contemplate the ways forward. Let me begin with dimensions and contours. May I request you, Salim, to share slide 1 with everybody? Table 1 presents the cumulative totals of COVID-19 cases and deaths in South Asian countries. India ranks second in the world in terms of the number of cases after the US, and third in the world in terms of number of deaths after the US and Brazil, respectively. And you can see the vast difference between the numbers of cases and numbers of deaths in India as compared with other South Asian countries. Bangladesh and Pakistan are broadly similar, except that Bangladesh, with a slightly larger population, has a smaller number of cases and a distinctly smaller number of deaths. Sri Lanka and Nepal, you can see, well, Sri Lanka has much fewer cases, but proportionately high deaths. And Nepal, for its population size, is quite large. The deaths per million, which is the usual metric, is also presented in the table. I should add that there are 2 countries missing, Bhutan and Maldives. In Bhutan, there were 2,000 cases and 1 death. In Maldives, there were 70,000 cases and less than 200 deaths. But relatively speaking, very small. Now, deaths per million in South Asian countries are compared in this table, and the deaths per million in the world as a whole are close to 500 per million, just for your reference. Now, the distribution of cases and deaths was uneven, not only between countries in South Asia, as you see here, but also over time. In this respect, in terms of temporal differences, South Asian countries were very similar over time. There was a first wave from April to September 2020 that was modest in its impact. I have argued elsewhere that this was attributable in part to demography, the proportion of young in the population, in part to immunity that may have been innate for a variety of reasons, including BCG vaccinations, which might have created pathogens that were resistant to other infections, and geography. Rural hinterlands in all these countries were spared the first wave by and large because the virus came with people who traveled from abroad. Okay. The second wave, however, which began in March and has waned in its impact, was massive in comparison, both in the number of cases and in the number of deaths everywhere in South Asia. This was in part because the virus mutated into new variants that had much higher rates of community transmission, but also because of, I'm convinced, negligence on the part of governments and people in these countries. Even so, when we situate the number of deaths from COVID-19 in national perspective, and I will here focus on India, although the other South Asian countries are not very different, the biggest killer is not the pandemic. In India, it ranks well behind coronary and heart disease, which leads to 1.5 million deaths a year, lung and respiratory diseases, 0.8 million deaths, strokes, 0.7 million deaths, influenza and pneumonia, 0.6 million deaths, and tuberculosis, 500,000 deaths. But in effect, the biggest killer in India and in South Asia is poverty, waterborne infectious diseases, nutritional deficiencies, and neonatal or maternal complications. As many as 300,000 infants die in India every year before they reach the age of 1 year. Another 1 million children die before they reach the age of 5. The story, with the exception of Sri Lanka, is not very different in other South Asian countries. And this is partly the poverty and it's partly the dilapidated, crumbling public health systems in South Asia. Now, if we situate the numbers I presented to you in historical perspective, it is seldom recognized, or was not recognized until so long ago, that India, at the time of the Spanish influenza in 1918, the undivided India, which is what South Asia is now, accounted for close to 1/3 of the estimated 50 million deaths from the Spanish flu in the 1918 pandemic worldwide. Okay. Now, let me turn now to the global context, which is also instructive. May I request you, Selim, to share slide 2? Now, please consider table 2 on the screen, which sets out the share of continents in world population in COVID-19 cases and in COVID-19 deaths. These are all percentages derived from cumulative totals as on 16 June 2021. That is the day before yesterday. Now, the continents are listed for you to see in terms of their share in world population, world cases, and world deaths. But if you were to take the industrialized countries, Europe, North America, and Oceania combined, it is striking that these three continents accounted for 15% of the world population, but a little more than half of COVID-19 cases and deaths. On the other hand, developing countries accounted for 85% of the world population, that is South America, Africa, and Asia, but less than 50% of cases and deaths. Now, if we were to exclude South America from the developing world, which is largely middle-income countries, you would see that excluding Latin America, Asia and Africa together are home to more than 3/4 of the world population, but they accounted for only 1/3 of the total number of cases and less than 1/4 of the total number of deaths. Now, in that sense, South Asia, which is a part of Asia, is somewhere between Asia and Africa on one hand and South America on the other. You will see the last line gives you the share of South Asian world population at 23.4, in the number of cases at 18.2, and in the number of deaths at 11.1. Now, Professor Sobhan raised this question with me before we began. There is no doubt that both the number of cases and the number of deaths are underestimated, underreported in India, as I presume they are in most South Asian countries, partly because of poor statistical reportage systems, and partly because of governments that want to conceal rather than reveal information. Even so, while the statistics that I have presented might underestimate the number of cases or the number of deaths, it does not explain away the kind of asymmetry these numbers show. So South Asia is bad news, but it is not the disaster story that it was in 1918, when it accounted for close to 1/3 of deaths worldwide. Okay. Now, I thought that is an essential place for us to begin, because we need to situate South Asia in its global context in terms of the impact of the pandemic. Salim, that's all there is for slides. We can stop sharing unless someone wants to refer to them again. I'm not very good or proficient with PowerPoints. I use this only to save time in presentations. Let me turn to the second part of what I wanted to say, which is about responses on the part of governments and of people. My focus will be largely on India, and I'm sure Rehman will bring up what happened in Bangladesh, but the similarities on the whole are greater than the differences. Now, for governments in South Asia, more so after the experience of Europe and the United States, where governments did too little too late, imposing and continuing lockdowns was the obvious risk-averse strategy. If the spread could not be restrained and managed, if the spread could be restrained and managed, the success would bring political dividends. If the spread continued unabated or worsened, the microbe would take the blame for the failure. It became the equivalent of one-way options in financial markets, tempting political leaders to think that they could not lose. This became even more attractive over time as it conformed to herd behavior by governments worldwide. Exit from a lockdown then posed a real dilemma for governments. It called for decision-making under high uncertainty, requiring courage that needs both conviction and confidence. The dilemma became larger than life when governments emphasized saving lives in the pandemic as their primary, if not sole, objective. Of course, the object of saving lives is in itself unexceptionable, but it must also be recognized that the health of people and the health of an economy are interdependent, where both, taken together, shape the well-being of people. Thus, saving livelihoods is an equally important objective. In fact, the relationship between lives and livelihoods is circular. If lives are saved, and in doing so, livelihoods are sacrificed, it threatens lives of people who are deprived of incomes and helps unable to meet their basic human needs. This could lead to widespread hunger, reduced immunity, and lost lives. Obviously, getting sick and going hungry cannot be an either or choice. Everyone would want to stay healthy and be well fed. It is the role of governments, I believe, to strike a balance and reconcile these two objectives rather than juxtapose them as conflicting, requiring a choice to be made. In India, the harsh lockdown in March 2020, at 4 hours' notice, created a humanitarian crisis of enormous proportions. The plight of migrant workers in urban India, construction workers, street vendors, restaurant employees, delivery persons, domestic workers, rickshaw drivers, and so on, was grim. Deprived of their work and dignity, uncertain about where their next meal would come from, stranded in mega cities, in search of night shelters and open kitchens run by state governments or charities, most of them. Thus, the draconian lockdown in India produced its own socio-economic version of Thucydides' version of the Thucydides' geopolitical dictum that the strong do what they can, the weak suffer as they must. The virus carriers were the wealthy, but the poor bore the burden. The privileged jet setters who imported the virus could work remotely from home and utilize private hospitals. But the poor who they infected depend on daily wages from manual labor and had little access to decent healthcare, were disproportionately devastated. The lockdown shattered almost two-thirds of the economy. It stranded 25 million migrants in cities far away from their homes. Mining, manufacturing, construction, trade, hotels and restaurants and transport, which accounted for both 40% for more than 40% of both output and employment, was shut down completely.
I'm not sure whether Professor Deepak Nair's connection got lost. We can wait a bit.
Salim, আমার স্ক্রিনের উপরে there is this thing called this meeting is being recorded, which is creating a block. So someone who is obviously put it there should remove it.
No, sir, it's actually a common message to everyone. So I think this is fine because you have to click on that. But if you don't click, that's fine. That should be fine.
But basically what is happening is that it is blocking the image of the speaker.
So
because it is remaining on my screen. So that is, I mean, Deepak is a very handsome person and I would like to keep on looking at him.
So actually you have to click on accept that one. Then in that, and then the box will disappear.
What do I need to do?
There's the box, it says whether you accept it. So you have to click on that accept on the box.
Well, it says in my case, continue or leave meeting.
Continue. I think continue, sir, please.
But I don't know how to remove that.
If you click on continue,
you can't remove it from that side?
No, sir. It's actually a common message. It has gone to everyone. And everyone has to accept
yes,
it.
because as Ronak told you,
I know, sir.
I am now helpless. I mean, apparently I have to move something, which I can't manage. But if I could just do it with my finger, that would be fine. But I don't think I can. I have to move some sort of a... Nope. Anyway. Will this affect me when I'm speaking?
No, sir.
You will be able to see me?
Yes, we are able to see you, sir, perfectly, sir.
Okay, well, ठीक है, then I shall have to manage with what there is. But it means that I'm not seeing either your face or Deepak's face. What's happened to this Deepak's sound?
Yeah, he's still not back. Still, I think he had a problem with his internet connection. So Professor Deepak Nair is still not here. I'm not sure whether. So we wait for a minute or so.
Who is managing your system?
No, sir. Actually, Professor Deepak Nair is not. He has not been able to get into that. I think it's problem at his end, the network problem. Sir, if he can't join in a minute or so, shall we start with you?
Well, we can do that, but it'll be a bit odd.
Yeah, I know, sir.
What you have to do is continue it cursor.
Just click on the continue, madam.
হ্যাঁ জানি আমি চোখে বয়স হয়ে গেছে চোখে কার্সারটা দেখা মুশকিল এই যে এখানে দেখতে পাচ্ছ রে মা এই যে এখানে এনে তাহলে তো এই যে ওরা আমাকে ফোন দিয়েছে ওকে হ্যাঁ এখন দেখা যাচ্ছে ঠিক আছে
হ্যাঁ আমাদের দিক থেকে ঠিক আছে
হ্যাঁ ওকে
No, Deepak was speaking and then he got cut off because of the connection got broken. Oh, well, somewhere, wherever it is, it is bola jay nahi. Why don't you call him? Someone should phone him and find out how his situation.
So we're trying to actually, sir, connect this, but unfortunately, so I'm not sure whether he has got a major problem in his internet. And it usually happens that if someone get disconnected within a minute or so, if there is no major problem, the connection gets reconnected. So
you should get, I'll start, but you should have someone get in touch with him.
We're trying to get him back. So you can start, please.
Okay. Well, Deepak, in fact, made a very good introduction and, in fact, very usefully identified the problem. I think a lot of it was essentially contextualized in the relationship of India. And of course, in my case, again, I will be drawing on the Bangladesh perspective. I'm not quite sure how far either of us are. Have you got him back?
Yes, sir. Professor Deepak Nair is back now.
Oh, very good.
I have no idea what happened. I was just disconnected and lost the connection. So I managed to get back now.
Thank you, sir. Thank you, sir.
Do you want me to resume, or do you want Professor Subhan?
No. You please carry on.
Okay. Well, I was describing the outcome of the harsh lockdown in India to suggest that much of the burden was borne by the poor, often self-employed, who constituted 75% and 50% of rural and urban households, respectively. The impact on micro, small, and medium enterprises, which account for 1/3 of output and 1/4 of employment in India, was absolutely devastating. Healthcare for patients, except for those with COVID-19, diminished sharply in terms of both access and quality. In education, learning outcomes, which are already poor, inevitably worsened with school and university closures. Yet, in India, at least so far, the sharp contraction in output and employment has not induced the government to adopt expansionary countercyclical macroeconomic policies. Orthodox thinking, obsessive about fiscal deficits so deeply embedded in the government, suggests the absence of even the most rudimentary understanding of macroeconomics. It also reveals an utter failure to recognize that we live in unprecedented, extraordinary times with the world economy in a crisis that could run deeper than the Great Depression 90 years ago. The idea that monetized deficits would lead to inflation is blind to the reality of a deflationary stagnation. In fact, what governments, I believe, need is helicopter money. The worry about a downgrade from credit rating agencies, which have witnessed a steady erosion of their ethics and integrity, is just bizarre. Now, I will return to this a little later in my presentation. But there are two other points I want to make in relation to the response of the government in India. First, its response on vaccinations is a classic example of government failure. Prime Minister Modi believed that in September 2020, he had vanquished the pandemic, the virus, the microbe, and did nothing, absolutely nothing, to place orders for vaccines. And please remember that India is the hub of vaccine manufacturing in the world. And it was only in April, when he was about to deluge by the crisis, that he placed orders. So that was a huge failure in the response of the government. And one other point that I am concerned about, and this is not just India, the pandemic has created an overreaching state. It has empowered the state almost everywhere. And in so doing, it has curbed the rights and freedoms of citizens almost everywhere, whether South Asia, the developing world, the industrialized countries, everywhere. And that worries me as a response. Now, if you think of people, physical distancing is almost impossible in South Asia because our countries are among the most densely populated in the world. It's feasible among people who live in homes that have doors with private spaces as individuals or households. But it is impossible in urban slums or shanty towns where people live cheek by jowl, often 10 or 12 to a room, or even in the rural hinterland where people live in cramped spaces. Our people are also reluctant to wear masks, just as they are reluctant to observe lockdown disciplines. Human beings are social creatures everywhere, and they find this oppressive. But in our societies, that has not been easy to do. And vaccinations, although they have not been available because the hub of manufacturing vaccines, India, failed completely in this task. But even the idea of accepting vaccinations, there is a resistance to vaccination in our societies, not only us, but even in the United States. So the responses of people also leave something for us to worry about. Third, let me turn to the economic, social, and political implications of the pandemic. And given that we lost some time thanks to the disappearing connection.
Please take your time, sir.
Okay.
Want to
All right.
read it.
I thought I should be brief. Okay.
No, sir, please.
Now, I want to make a few points in bullet form about the economic, social, and political implications of the pandemic in South Asia. And I move away from India. That was my focus in the preceding part of the presentation. First, there is a sharp economic slowdown and a massive contraction in employment opportunities. Recovery in South Asia, everywhere, will be slow. It will take at least 2 years, if not longer, for economies to return to pre-pandemic levels. The burden of this impact will be borne largely by poor households and small firms. And that is true everywhere in South Asia. Second, during the past 25 years, South Asian countries witnessed a massive reduction in absolute poverty, both absolute numbers and the proportion of their population below the poverty line, or two poverty lines, say, that the World Bank uses. This was attributable in large part, and I simplify, to rapid economic growth in South Asia that began in the mid-90s. This trend is bound to be reversed now as the economic crisis driven by the pandemic pushes the vulnerable. And my definition of the vulnerable are the people who live between the two poverty lines. It pushes them into absolute poverty. The absolute numbers and the proportion of the poor in South Asian countries will inevitably rise. Third, the rapid economic growth over the past quarter century was associated with rising economic inequality. Had economic inequality not risen as much as it did, the reduction in absolute poverty would have been far more. Now, in a short span of 18 months, the pandemic has already led to a dramatic accentuation in inequality. There is a disproportionately large burden on the poor, but the corollary is that the rich and the super rich have got richer. And all available evidence suggests that recovery, such as it is K-shaped. And that's not just South Asia, it's everywhere in the world. Fourth, South Asian countries have always been laggards. Have been my study on the transformation of Asia that Selim referred to at the beginning shows that South Asian countries have been laggards in the remarkable economic transformation of Asia over the past 50 years, not only in terms of economic performance, but also in terms of social development. This gap, I fear, will widen further. Fifth, and this is something that is not talked about much, COVID-19 will leave behind in its wake, among people who were infected, a legacy of health problems, some of them difficult to understand and to cope with. These problems are respiratory, cardiac, problems of diabetes, which surfaces after COVID, and what is now described as COVID fog. It affects both memory and cognition. Now, in healthcare systems that are already stressed and dilapidated, this is going to be tough to cope with. At the same time, the prolonged closure of schools and colleges will worsen what are already poor learning outcomes in most of South Asia, with a few exceptions in countries and some parts of larger countries. And last but not least, this is something that worries me as a citizen of South Asia, as a citizen of the developing world, and as a concerned citizen of the world, that the empowerment and the overreach of the state brought about by the pandemic will undermine already fragile political democracies in South Asia and elsewhere. Now, at this juncture, democracy or political democracy is at risk, not so much from monarchs or generals, as it used to be. It is at risk from political leaders who came to power through elections in an established democratic process, but seek to undermine that very democratic process that brought them to power. Prime Minister Modi in India is a classic example. No? But there are many others, whether it's Bolsonaro in Brazil, Putin in Russia, Erdogan in Turkey. There are many examples of these populist authoritarian regimes. And in other South Asian countries, political democracy has always been fragile. But a kind of a state empowered without fetters represents a danger. That worries me. Now, let me turn to the fourth part of my presentation. It is essential to recognize that lockdowns are not weapons in a war that can conquer or vanquish the microbe. The virus will be with us for some time to come, so that spikes and surges may recur over time and across space. The fate of this virus, I believe, is going to be determined by two variables. First, what fraction of the population acquires immunity through vaccination and infection, including asymptomatic infection. And two, what proportion of the population already has some form of resistance to it. Thus, governments should respond with effective risk management instead of reacting in haste or panic with misconceived policies, which they have done, and particularly so in India. Now, if there is reason for hope, and I speculate, I find it in evolutionary biology. It is plausible to argue, but impossible to prove, that evolutionary biology as a discipline and going back in history suggests that viruses have finite lives. They tend to exhaust themselves and die, either because they mutate too fast or because they don't have a large enough stock of vulnerable population. But this would be true if the virus emerged from the wet markets of Wuhan, jumping from animals to humans. But if this virus is man-made in a laboratory, that evolutionary biological explanation probably is not plausible. Now, in contemplating the future, I want to say that much like every challenge or crisis, this pandemic also presents its own opportunities in terms of rethinking macroeconomic policies, in terms of rebuilding crumbling physical infrastructures, in terms of investing in social infrastructure, both education and health, that are long overdue in South Asia. Now, those who worry about the consequences of expansionary macroeconomic policies should provide their alternative for recovery, while the government should worry about the consequences of not doing this. If an economy is in free fall, the massive slippage in government revenues would balloon the fiscal deficit to similar, if not higher levels, without any hope of recovery. Now, the belief of orthodox economists in the strong spring analogy, the harder you push an economy down, the greater the force with which it bounces back, is an illusion. In reality, a weak spring is the more appropriate analogy for an economy, for when it is pushed too hard, it may simply remain there if its restorative forces are destroyed. So the need to rethink macroeconomic policies is paramount. But beyond survival and recovery, there are also opportunities in this crisis, which need to be, and I believe could be, captured by governments in South Asia. But there is a clear and present danger that these might be missed by conservative, possibly timid mindsets which do not seem capable of thinking big or thinking long. Now, there are opportunities which, if captured now, could bring enormous dividends in the medium term to every South Asian country. There is a crying need for massive investments in physical infrastructure, particularly power, roads, transport, and ports. This should be done by governments without moaning about finances or without waiting for private investment to build infrastructure, because that is waiting for Godot. And it would serve two purposes. As government expenditure on infrastructure creates employment and stimulates demand to revive economic growth in the short run and remove supply constraint that would stimulate the economy through strong multiplier effects in the long term. Above all, I think this is a wake-up call for all of us in South Asia to invest in our social infrastructure, both health and education. Improved public health systems would save lives lost through easily preventable causes, child mortality, for example, to bring about significant improvements in the well-being of our people. Improved public educational institutions could transform the present situation in terms of learning outcomes. It is essential to remember that over the past half century, and that is the moral of my story about Asia in an ambitious study, education and healthcare provided the foundations of success and development in the rest of Asia. And this is where South Asia, to this day, remains sadly wanting. And I will now bring my presentation to a short conclusion and return to the global context. This virus, or any other, or germs, do not recognize borders. Therefore, pandemic nationalism unleashed by so many governments and political leaders, driving what I describe as sicken thy neighbor policies, is utterly misplaced. Espousing nationalist rhetoric and policies while abandoning international cooperation, I believe, has aggravated the crisis. It is time to recognize the logic of international collective action. That seems to have been forgotten, apart from some lip service at the G7 summit. Alas, there is a political meltdown in SAARC. It does not exist as a meaningful political collective organization or entity. Even so, South Asian countries, where governments seem reluctant for a variety of their own reasons, civil society and citizens must recognize the enormous potential benefits of cooperation on responses to the pandemic. If you think of the second wave in Nepal, it has to do with unrestricted cross-border movements of people with India. The virus travels happily across borders. What I'm saying in an epithet is that when you have problems without passports, then they require solutions without passports. Okay? And that in this South Asian cooperation, even if it is at the level of citizens and civil society, would help. Yeah? Because there is much that we can learn from each other about what we did right and what we did wrong. And experience everywhere produces best practices. What is more, despite the failure of Prime Minister Modi in recognizing the importance of vaccinations and vaccines, vaccines from India, if not now in calendar year 2021, by calendar year 2022, will be the major source of supply of vaccines against COVID-19 in the world. Because large international pharmaceutical firms do not spend money on vaccines because the demand is for once and for all. And therefore, all vaccines are typically produced in other countries except at crisis time. And India has this capacity so that the possibilities of sort of learning from each other and cooperating with each other in managing the pandemic would get us much farther than we have so far. Thank you, Salim. I'm sorry we overran, but I lost the connection for more than 10 minutes.
Thank you, sir. Thank you so much. I think, we are so grateful to you for such an insightful, deliberation at the beginning. And definitely, I'm quite sure that, sir, there will be some questions and, for you, which will come in this stage. And thank you, sir. Thank you once again. So we now move to Professor Hemant Sohan. Sir, over to you.
Right. Well, to begin with, let me congratulate Deepak for this quite outstanding opening presentation. I think what has been sort of particularly valuable is that he, without actually investigating more closely the problems of the region outside of India, has in fact in his coverage actually spoken for much of the region, and certainly much of what he has said will be resonating within Bangladesh in terms of the way in which COVID has impacted on us, both in terms of the health level and also in terms of its impact on the economy. But as may be expected, there are very sort of significant differences also, and there are nuances which you need to take into account. So that in my response, again, while we have both been speaking on South Asia, he has largely been speaking from the Indian perspective and drawing on the Indian experience, which he has already written some quite valuable papers. So too will I be speaking, drawing on the Bangladesh experience without, unlike Deepak, having the qualification of making any significant contributions to the literature as he has. We will, by a process of osmosis, try to, in fact, superimpose our collective findings on our respective countries and project them onto the experience of the other South Asian countries, though how far this would be validated remains to be seen. I should suspect that we would resonate to a great deal in both Pakistan and Nepal, and possibly Sri Lanka. But I suspect that a very significant outlier is going to be, of all countries, Bhutan. I'm not sure how far we could say the same for the Maldives. I will, in fact, give one example. When we were commemorating the centenary celebrations of Bangabandhu recently, the 5 prime ministers, presidents of the region came over, taking some risk themselves to, in fact, participate in the celebrations in March. And the Bhutan prime minister, of course, was one of them. He spoke very well. He actually had he's a medical doctor and went to medical school in Bangladesh, in fact, in Mymensingh Medical College. But what he told us was that when he went back to Bhutan, he would be put into 2 weeks of quarantine over there. And he would have to observe that discipline, even though he was the prime minister of the country. So this greatly impressed all Bangladeshis, because I could not imagine similar disciplines being imposed on sort of political masters in any other South Asian country. And some of the numbers that Bhutan, in fact, has been projecting, both in terms of its infection rates and its death rates, do suggest actually that considerable discipline has been maintained in the way in which they have actually responded, at least to the health problems and the impact this has then consequentially had. However, to get back to what I know, and to hope, in fact, that this says something about some of the other countries. Now, where I will perhaps attempt to move beyond the presentation by Deepak is, of course, to say something a bit more about South Asia in terms of its post-COVID economic recovery process, and how this will relate again to the changing global economic ecology, which may be emerging out of the COVID crisis. And conclude by then looking at what Deepak touched upon in his conclusion about the nature and both failure and prospects of a collective response within the region. Now, looking at the issues which had already been covered by Deepak, in the Bangladesh experience, all of us have, of course, noticed that actually the first phase of the crisis, in fact, was more severe. And of course, we went through again our U curve when we thought that the impact of the crisis had been considerably reduced. The numbers, as Deepak has pointed out in the tables, were significantly lower in Bangladesh, compared certainly to India, but also to some of the other countries in terms of the infection rate. Now, the big problem with this is that Bangladesh has also had one of the lowest testing records, not just, it was certainly the lowest testing record in South Asia, but also across the world, it had one of the lowest testing records. So what we do not actually know is the extent of the infection, which in fact has been recorded both in the first phase and now in the second phase. We continue to claim that our numbers remain low, even though there's now been a rise in the infection rates with what we are now calling the Delta COVID infections. But we have no idea really about what level of increase has taken place because our testing rates still seem low. In fact, our contemporary testing rates are lower than some of the rates we were recording in the first phase of the crisis, because again, the testing rates began with a very low level of testing, then they rose and then they went down again. So this means that we are operating in a no man's land in terms of infection rates. Our death rates are likely to be more accurate because death rates tend to be more visible. I think India is a bit more in a better position to assess death rates on the ground because of the more conspicuous way in which you, in fact, dispose of your departed. And in the Bangladesh case, burial space in any case has been very scarce, even in normal times. So where and how people are buried itself remains a much more sort of obscure process over here. So how far burial rates as recorded corresponding to death rates has actually captured this process, we are never entirely sure. But it could be reasonably argued that if there was a significant excess of death rates over those which are being officially reported, there would be some conspicuous physical evidence coming towards us. And of course, I don't think that there has been any great level, but there is a reckoning that there is some general model of looking at deaths over the normal trend rates in general, and then attributing this to the COVID. This could give you some numbers, but that sort of math has not really been effectively worked out in Bangladesh. And I suspect probably in no other country in South Asia. I reckon that only India has got the enumerating and statistical resources to do that, and how far they have actually attempted to do that, I'm not quite sure. But certainly we would be technologically incapable of going down that route. Now, the response, which again has been there, has again been very similar to that of India. But there have been very significant differences over here in the Bangladesh context. I mean, we too went for a lockdown in the initial phase. But the problem with Bangladesh is that our capacity to administer any sort of regulatory process has always been quite weak. And the capacity to actually enforce lockdowns to the extent that may have been enforced in India, and which compelled large numbers of people to then sort of migrate to the villages, is more questionable for the Bangladesh context. So that at all points, while we were having lockdowns within the views of everyone, which was being captured on our television screens on a regular basis, you had 1 day of traffic suspension. And then within 3 days, you were having traffic jams on the sort of main roads of Dhaka and significant points of departure from the enforcement of transport lockdowns. So again, you are never quite sure how the regulatory process is going to impact. And so the lockdowns themselves seem to have had a questionable impact. I think the central problem with the lockdowns, again, was common to you and common presumably across South Asia, that it's all very well to lock down people, but how do you solve the livelihood problems? I was reflecting on the situation in the United States, for example, where I guess when they went for lockdowns, which weren't being frustrated by Mr. Trump and his constituencies in particular states, at least the advantage was that they were giving regular income transfers on a fairly massive scale and unemployment insurance, which was again sort of generally universal, to cover virtually the entire population. So that this then provided a protective floor, which really did not exist over here. So that the compulsions then for people to come and violate lockdowns was in fact quite elemental over here. And I should imagine that this again was the problem in every South Asian country, that you imposed lockdowns without any compensatory intervention, either for giving people income opportunities, but more to the point, also being able to then deliver to them basic needs, even when they actually had incomes to spend. So these remain unresolved problems, and then compelled people to come out the home. I mean, the standard response of people who are sort of roaming around in the streets, ki ami na khe morbo, will I then be compelled to die without eating, was really an unanswerable sort of proposition when it was put to people. And after our law enforcement agencies spent a day or two sort of beating up people and sort of generally fining them on the spot, I think they too then sort of really woke up to the objective realities and then sort of relaxed their incidents. I mean, they may, of course, as always, have gone in for their appropriate share of rent extraction at that particular moment of time. So that remains also a further constraint in our system in enforcing any sort of lockdowns. So the end result was that the capacity to, in fact, contain the process and contain processes of transmission remained weak then and remained weak today. It was very interesting because the second phase, which in fact has been triggered off by South Asian cooperation manifesting itself through the movement of Delta COVID across the West Bengal border into the border districts of Bangladesh, has then the immediate response in the border districts was then exodus from the border districts for those who could actually afford it, or for those who were more adventurous, to then really head for Dhaka. So you could then neither enforce effective lockdowns in the border districts to contain people from moving out, even though in theory you were having lockdowns, nor could you in fact contain have lockdowns to prevent people from coming in from the infected border areas into Dhaka. So the end result was that this again became a sort of no man's land, and there was really not very much that you could actually do about it. The transmissions which were supposed to be coming across from the Indian side were supposed to be contained at the borders, and you were enforcing effective border lockdowns in theory. But in practice, you could hardly do so because large container loads of food and intermediate inputs were coming across the border. And enforcement of lockdowns or enforcement of regulatory interventions remained weak, both in terms of testing of drivers and containing them and really sort of de-infecting the containers themselves. And significant numbers of people who were in India and who should hopefully have been kept there because that was really the proposition, could not be contained. They were the official people who managed to somehow get clearances from the embassies to come across. And then there were the large numbers of people who cross borders as a matter of routine, for whom the Indo-Bangladesh border at West Bengal is sort of really a slight inconvenience, but it's really an integrated region over there, where people go across to sort of do their evening shopping or to go and see a movie or to go and get a medical checkup, and then they move back again. And no one was really being able to contain movements across that border, so that, again, infection rates were infiltrating over there. So I mentioned this to essentially show that collective responses were very critical. There was a complete failure over there, and the way in which you had a regulatory response over here. Now, it would be very interesting, for example, to see how correspondingly this was being observed when you are looking at borders between Afghanistan and Pakistan. We are certainly aware that there was a complete breakdown in terms of movements in the second phase between Nepal and India, where, of course, you have an open border and people come back and forth because there's no really visa regulatory process. And now this has had a significant impact in Nepal. Now, in terms of the recovery process, again, we were really dependent on, I suppose, what we regard as the forces of nature, that in spite of these public failures, you had a natural capacity for people to really react to it. Now, I don't know whether your hypothesis, which you originally postulated in, I think, some of your earlier writings about the South Asian response, remains perhaps more relevant to Bangladesh. It's certainly a good deal less so for India, but well, that may well be a proposition. I mean, there's one popular theory that people are in any case historically exposed to so many viruses of all varieties that they have built up some natural immunity anyway, but then that really remains a hypothesis and no one has actually tested it. So our hope for moving into a high-profile vaccination program, which began very well because we had entered into a collaboration with your COVAX, what do you call them in India? COVAX? The company which is Serum, where we agreed, where we had an agreement to bring in the AstraZeneca vaccine, and the first phase came across very rapidly, and it went brilliantly. Everyone was complimenting the government for the effective vaccination program and how effectively it had been put into place. There was a peculiar intermediation from the private sector in Bangladesh, where one of our large pharmaceutical corporates then intermediated the transaction for reasons which still remain unexplained. But the first phase seemed to have gone very well. I'm a beneficiary of that, and Ronak and I had double vaccinations, as in fact did the whole of the staff of the Center for Policy Dialogue. We could ensure that everyone from the professionals to the service staff could all get vaccinated, including our household staff. So that worked very well. But then the whole thing broke down because of your second wave. And there was a big contract default on the part of your Serum, who then did not really deliver on 2/3 of the obligation that they were supposed to deliver, which meant actually that a significant number of people, I think, what is it, about 1 million or so, who in fact had the first injection, could not really get the second one and are going around pushing the US administration to release some of their AstraZeneca stock to Bangladesh, but making special appeals to Mr. Modi and to the Indian government to at least send enough of the AstraZeneca vaccine to us to complete round 2 for those who win. But this has, of course, not been done. In a way, you can quite understand if India is suffering now from a big deficit in its own sort of vaccine supplies and the vaccination capabilities. And this itself has now become a big political crisis in India. It's certainly then you are not going to indulge in greater South Asian cooperation, however much you may wish to do so in this. So, but the problem in Bangladesh was that instead of putting all our eggs in the AstraZeneca Serum basket, the logic of it would be to have gone and diversified your supplies, because they were in any case not going to commit the full supply to meet the entire needs. And we should have entered into partnerships with the Chinese, which were offered to us at a very early date, where they invited us to also participate in the testing phase, which would have then put us in the front rank of receiving the vaccines. But not having done so, we are now very low in the queue, and hopefully at some stage, both the Russian and the Chinese vaccines will come over. But right now, there is a big vacuum, and no one is being vaccinated. And this is the situation for the last month. And we are wondering how long it will be before vaccinations will actually resume. About 200,000 gifted vaccines have come over from the Chinese. So this means that the response has not been great. And of course, our healthcare system is, again, not been of the best. Our healthcare has always been both deficit in terms of its allocative priorities, such as in India, been low in priority listing, but more to the point is our health governance has been exceedingly poor. It is always, and over many years, not only had low allocations, but it has been one of the poorest utilizers of the allocations which they actually received. So that in fact, they were caught with considerable gaps in the system. And this problem has persisted into the present system, so that a weak health system, and particularly at the level of public healthcare, with very weak governance, in fact, has really compounded a problem which need not have been there. And our responses as a consequence of this has then been slow and inadequate. Now, to move on to the economic impact, the story again for the South Asian region has remained much the same, and so too has it been in Bangladesh. There has been, of course, macro impact, largely transmitted to us first through our export markets, in fact, going into retreat because of the crisis of demand in the market internationally, which has actually now recovered to a considerable extent, and we are getting back to pre-COVID levels. But in the domestic market, there has been significant problems. There have been both demand side failures that have then had very significant impacts on the income earning capacities of the most depressed sections of the population, which has again the standard narrative for all of South Asia. That, I don't have to sort of repeat that narrative. You've already done so in your context. Now, again, whilst there was an initial problem of increased unemployment in the formal sector, without actually going through any recovery or intervention, we reopened our garment industry and attempted to then sort of restore supply side responses and really have been keeping pace with whatever demand recovery has been taking place in the international market. But over here, in other areas, particularly at the micro and SME levels, there have been big deficits emerging. And over here, the demand failures have impacted on markets, as they done in India, and the capacity to then respond to this has been inadequate. Now, the consequential outcomes of this, of course, have been GDP slowdowns, growth slowdowns. Now, in India, I've seen that there have been very significant recession in your GDP numbers. I think you had an 11% decline in the GDP. Now, Bangladesh, of course, and here again, you are never really sure about the validity of the statistics. I'm not quite sure whether Salim, who is much more au fait with numbers, will risk, in fact, making some guesstimates on that process. But we were always claiming that we were having robust growth of 5 and 6%, even in the middle of the crisis, and are now talking about 7% growth rates this year. But no one really knows what are the facts on that. The World Bank halves those figures when they make their estimates, and then this has to be publicly denied by our finance minister. So we are left in this gray area. But certainly the impact on the GDP and the macroeconomy has been less significant than it has been in India. And whilst I was looking at the numbers, all the official figures indicate negative growths in 2020. Bangladesh was perhaps the only South Asian region, and perhaps Bhutan demonstrated a 1% growth rate, but we had the highest growth rates. Now, while allowing for some exaggeration, I think we were still probably having a plus figure, because objectively we know that you had a very good year for the agricultural sector, which for some reason remained reasonably robust throughout this particular period. Now, in these circumstances, the main incidence was then on the impact on poverty and correspondingly on inequality. These were, of course, standard explanations, and the usual suspects who contributed to the growth in poverty were there for us as they were for you in India, and as they were presumably for every other country in South Asia. The service sectors, the informal sectors, they were the standard victims. Now, I remember, I keep citing this example without getting any updates on the information from India. I remember our mutual friend, the late Arjun Sengupta, once chaired a major commission during the Manmohan period on the Indian informal sector. And one of the very interesting recommendations which we had made was that there should be a system of insurance protection or social insurance protection for the informal sector. I don't know if you recollect that, but I imagine that very little was actually done about it, so that in fact, when the crisis struck them, they then became the paramount victims. Now, here too, this problem actually applied. Now, this essentially meant that whilst this became the major crisis sector, you had widening of inequality, because obviously those who had the capacity for being resilient in terms of having both savings and resources could go on with their business and could maintain their conditions of living. I mean, the standard model essentially was the garment owners who were living in their in their sort of multi-storied apartment buildings and houses in air-conditioned bliss, whilst in fact their workers were walking 1 hour to work and then working there, hoping for the best that they would not really be affected, and enabling then our export recovery to take place. But most of these factories could be micromanaged sitting at home by, in fact, actually using the digital systems to, in fact, actually monitor it. So there was a complete asymmetric distribution of risk in this, but also an asymmetrical appropriation of profit and loss as far as the system actually goes. Now, this was all reflected in the response to the crisis. The government, as in all other countries, went for the two-pronged response. One, of course, was injections of money, the monetary response of injecting money into the system by, in fact, running a fiscal deficit. But unlike in India, our increase in the fiscal deficit was really quite modest. It was targeting 6%, but it may not even have actually reached that, which I think may be the normal deficit which you actually run in India. And we have always kept a fairly sort of tight fiscal deficit. Monetary injections, again, really put the main burden on the banking system to, in fact, put money into the economy in order to really boost credit flows and to then stimulate economic activity. Now, the problem with this was that the main recovery phase was then put on monetary policy rather than fiscal policy for really promoting economic recovery for the economy. And this was inevitable under those circumstances because the monetary economy, which was then being sort of managed largely by the private sector, they are the main suppliers. But you also have a large, significant number of state banks, government banks, really channeled most of that credit into the bigger enterprises for the obvious reasons of sort of social and logistical reasons, that these are the people with whom you do business. You are asked to be democratic in the distribution of credit by stepping up flows to the SME sectors. But you have not, in spite of everything, learned effectively to deal with this sector. And this has been one of the big failures of the business governance, that in spite of the fact that policies and social and political rhetoric have targeted the need to stimulate these sectors, you really have not developed efficient delivery mechanisms to direct monetary flows to this sector. So this has meant that a large maldistribution of credit transfers went into the larger sections of the economy. In a way, this was okay because that was also linked to the export sector. But one of the big problems, of course, is that this is going to leave Bangladesh. And I imagine, again, certainly countries like Pakistan, which have very big debt default overhangs, with a much larger problem, because the way in which this was incentivized in Bangladesh was that the government, in fact, subsidized interest rates and, in fact, then went for deferment of giving latitude to the banks to defer collections of debt and to go for large-scale debt rescheduling. Now, since you were already carrying very significant loads of debt default, and this had been compounded by considerable amounts of debt rescheduling, we do not know what the burden is going to be on the banking system, which has really carried the whole burden over here. Now, in these circumstances, you have had an inequitable response to the crisis, which could have been compensated by the fiscal transfers really going in for a major corrective intervention. Now, here, the government has claimed that it transferred, was intending to transfer this year 100,000 crores of takas to the deprived sections of the population. And of course, we don't really know how much of it is going to get to them, because the way they structure the social transfer budget is that they incorporate then pensions of civil servants and even subsidies to the agricultural sector and various other things which should not really get into the transfer programs, so that the numbers may be somewhat lower than that. But however, whatever is there is significantly lower. The numbers which are being transferred are not significant. In a dialogue the other day, we were making comparisons with transfer programs in India, where our numbers are considerably below that. Now, I don't know how far the Rural Employment Guarantee Program was brought into play in India, because in theory, people who were then losing their jobs in across the country should all have been compensated by being given work, or if not being given work, then to be delivered with cash transfers in lieu of wages for working on your works program. Now, we had no corresponding program of an institutionalized nature over here. And so you had a whole plethora of the standing ad hoc interventions, plus significant transfers, which again had leakages. So you generally have problems of both exclusion and wrongful inclusion, which again are standard problems of delivering transfers. So the impact on poverty has then naturally been very significant. I was looking at a recent paper by Salim and his colleagues. I think you came up with 25 million of the new poor, as you call them. Of course, he and various other people who have been giving numbers are recently within the sort of firing line of the finance minister, who, of course, not having made his own enumerations, because the household income and expenditure surveys are about 4 years behind schedule, then has the privilege of questioning whatever exercises have been carried out by our research people like Salim, without actually having anything to put in its place. So since he has the microphone at his disposal, this gives him a certain disadvantage. And of course, I leave it to Salim to make an appropriate response on that. However, it is self-evident that significant increases have taken place. But again, the problem has been the conceptualization of poverty in the poverty line itself. I think I remember when India went in for a revision of its poverty line, I looked at the numbers, and by raising the poverty line, about 75 million Indians then suddenly were reclassified as poor. So over here, it suggests that within this sort of margin, you have got significant people living in a no man's land, where any crisis could drive you below the poverty line, and any good year could drive you above that. So all these people who entered into the new poverty were probably, by a reclassification of our poverty line, have been old poverty in any case. And the relevant problem again was the degrees of vulnerability which they face. You know, there is a good literature on that. You were present in that paper I presented in that lecture in Delhi on this subject, where I addressed the issue of vulnerability as the major metric rather than drawing on poverty lines. And you will look at the various segments of the population which are vulnerable and which immediately went into crisis, and you would have needed to have been designing your interventions for them without a COVID crisis, because you would be addressing vulnerability rather than just looking at the numbers. Here you've got a class of policymakers who have this self-congratulatory impulse which is based entirely on looking at the poverty line and the numbers of people crossing back and forth, which is, as far as I'm concerned, a completely meaningless metric for really, in fact, determining policy interventions and evaluation of policy outcomes. So this remains the issue here. Now, let me round this up by addressing the South Asian implications of this. Now, the narrative we have automatically assumed, Deepak and I, has extrapolated itself to certainly Nepal and Pakistan. You can ask Suleri and a few others whether they can, in fact, actually endorse our narratives attributed to them, and whether we have actually done so legitimately. Here, I think the big problem has been that South Asia has, I think, suffered from very standard problems of having weak social sectors, low in terms of allocations, in spite of all the messages coming from Mehboob ul Haq in Pakistan and Amartya in India, and their acolytes all over South Asia about the importance of changing allocative priorities. Nothing really has been done over the years. More to the point, these also remain the worst governed sectors for various reasons, so that both the intervention failures and the capacity to effectively administer them without significant rent seeking, and again, significant institutional and administrative problems remains an ongoing problem. I think in the electronic age, it is now being claimed, certainly in India, that digital interventions have done much to improve things. I don't know that we are getting to make similar claims in Bangladesh. Again, no one has really tested it, because lots of things are said in an exhortatory tone without anyone actually putting forward empirical evidence of even a minimal nature to actually support this. Now, how is our recovery going to fare in the wider global context? Now, partly those of us who still remain dependent on markets in Europe and North America will still remain sensitive to the recovery processes over there, and how quickly the recovery processes are translated into global stimuli, so that they can then resurrect unrestrained export markets. Because even today, whilst our exports are being revived over there, they are still behaving over there in terms of the market chains as if they are operating in a buyer's market, so that they are driving down prices, they are delaying repayments, and all these sort of exploitative relationships which exist even in good times have really been aggravated today. And so there will then be an element of a perpetuation and aggravation of global inequalities, and further manifestation and perpetuation of the global injustice which really exists in the supply chains, both at the export and import level, which I think has been inadequately addressed in the literature. As I said, the standard problem which I tell you about, and some have attempted to research, of the $20 shirt which is being marketed in Walmart, which in fact is bought here for $3 or $4 in Bangladesh. So no one has really given a satisfactory explanation of what happens to those $15. Now, if that gap has been widened now, and the COVID crisis will be used to further widen and perpetuate that, then that is a problem which will demand address. Now, The second problem is, and I think here you will be much better informed than I, because you are doing your research at a pan-Asian level, is that there's going to be, has been already, and is going to be a much more so significant restructuring of the global economy. And at the center of this restructuring process is going to be the asymmetrical impact, both in terms of what has happened and what is happening and what is likely to happen to the two leaders of the global economy, the United States and China. That whilst the United States went into recession, as did Europe, China managed to contain this process, has revived much more rapidly, and in fact is really moving ahead. So the widening gap, both in the trading system and in the accumulation of capital surpluses, is already manifesting itself. Now, the further implication of this is that China has the added advantage of having very well integrated supply chains with virtually all the Southeast and East Asian economies. Up to a point, it has robust supply chains with South Asia, but most of this is really through export surpluses into the region, and their import chains are really very underdeveloped compared to the supply chains which they have established with virtually every single Southeast Asian and East Asian country, where China actually, with one or two exceptions, remains their largest market. So the recovery of the Chinese economy has in a way already had a very robust impact on Vietnam, which has been one of the closest linked to China, and which has also had one of the strongest responses to COVID and the strongest recoveries in the region. So this will mean a redirection, further redirection of Asian trade towards China, and a further widening of the gap between at least this part of Asia and the remainder of the world, but particularly North America and Europe. China has already emerged as the major trading partner of Africa, and it is also now emerging as the major trading partner of a very significant number of countries of Latin America. Certainly for most of the commodity suppliers of Latin America, it is now their biggest market. So that their revival would again have a stimulus in that region. So this means that the recovery process is in a way going to be a very China-centric process. And the question now is that will this have a positive impact on South Asia as a region, or will it actually have a series of bilateral impacts on individual countries, which will attempt to plug into the Chinese revival, and which in a way will actually have a corresponding detraction from integrating into the South Asian system? Because one of the big failures of South Asian cooperation has been the very low level of integration and the very weak supply chains which actually exist within the South Asian region, in contrast to the very strong and growing and robust supply chains for China and the Southeast Asian region. So now if South Asian countries find it much more sensible to build up relationships with China, to seek entry into the Chinese market, to then get Chinese capital to come in and to in fact actually develop these supply chains, then this is largely going to be, well, I wouldn't say largely, but partially it is going to be at the expense of the chains they have within South Asia, but also it will be a restructuring of their trading relationships with Europe and North America. So this is a dimension of the problem which needs to keep in mind. Now, since we have got no functioning South Asian cooperation mechanism over here, there is simply no machinery at the official level to take cognizance of these significant structural changes which are going to emerge in the post-COVID situation. And what you are then going to have is a much more autonomous market-driven process for South Asia, operating largely at bilateral levels, structured again by the degrees of their relationship with China and by the ways in which China is then going to continue to come forward and invest both in commodity extraction, in investing in manufacturing, and of course then through the BRI in investing in the infrastructure developments in the region. If they then emerge as the major sources of investment, they have already done so in Nepal, they have already done so in Sri Lanka, they've already done so in Pakistan, they're already doing so in Bangladesh, then again you have another problem. So essentially, what you are left with is a lament that if South Asia as a region needs to look to its future at the official level, they will need to, in fact, be much more proactive at the intergovernmental level in addressing these significant structural deficits of the system to see what we can actually do to deal with the post-COVID world. All we are left with then is civil society. Now, Deepak, you and I have trafficked in the highways and byways of civil society through SACEPs. I was one of the founder members. You are now its chairman, and you are remaining one of the last flyers of the flag of cooperation at South Asian level at civil society. SADEM has done an excellent job in bringing together young scholars to do collective research. I'm very impressed with the work which is being done by Mushfiq Mubarak, a Bangladeshi at Yale, who's put together a network of South Asian scholars who in fact have been doing RC, what do you call it? Randomized control tests to establish various ways in which masks can be delivered. I'm not quite sure that he was, the objective function in his exercise was the right one, but at least the intentions were good. And we have to see, I don't know if you are an admirer of RCTs yourself, Deepak, but what is significant about his effort, it was a collective enterprise of South Asian researchers. So what we hope for then is in the big failure of states to address these problems, there has to be a major intervention at the level of civil society, both in terms of its research community, as also in terms of its civil society, the big organizations like SEVA and BRAC and others like that in Pakistan, coming together and actually trying to resolve some of these problems which will remain unaddressed in the agendas of the respective governments. I mean, we all have talked about the opportunities and the response to that, where every crisis then creates its own opportunity. I would not invest a great deal of money in betting on governments of South Asia, because governments are basically the product of what they are, their politics, and their sort of social constituencies and the dynamics which they have established. And I do not see them actually coming up with very imaginative recovery solutions of a long-term structural nature, which will address the problems you have identified of growing inequity and weak capacity to respond both to crisis and also to widening inequity. So this remains the challenge which has to be taken up by civil society, both at the research level and at the level of civil society, where we will be sharing experiences, where we will be even collaborating in our interventions to come together and create big community responses where major civil society organizations will come together to address crises which are being inadequately addressed by the state itself, and whether we will then see a regeneration of civil society at these two levels to then provide the stimuli and the necessary advocacy interventions to persuade the state to get its act together. Thank you.
Sir, thank you, sir. I think you covered such a wide range of issues, and especially so relevant to the current situation. And towards the end, you had the kind of encouragement for us. I think it's so amazing. Thank you so much, sir. I know Professor Deepak Nair, he has to leave because of certain reason. But over to you, Professor Nair, because you have heard so many issues, and from Professor Sobhan, and also some of the points I also mentioned. So if you'd like to have some concluding remarks, I just want to add one thing, Professor Nair, is that, are you, sir, can you hear us, Professor Nair? I'm not quite sure whether Professor Nair is still with us.
Oh, he may not be.
I think his line got disconnected, probably.
Again, I see. Oh, well.
But anyway, sir, thank you, sir. I think one thing actually really came up, which you mentioned, is about the poverty rate and some of the data issue. And it's not only in Bangladesh. I was looking at the data for India. After 2011, India didn't have any, a nationwide household survey to cite any number or official number of poverty rate. So the problem is, I think it's very, kind of common problem we have in South Asia, probably at varying degrees. But one important point is that when the governments, they want to really have to respond to this crisis, do they have the fund? I think the basic question is, do they have any credible information or credible data? And when the government agencies who are responsible in generating those kind of information, and if they are not really performing their responsibility, then that question really remains. And you mentioned, sir, about the household survey data, which is dated, and also the labor force survey data is dated too in Bangladesh. And how can the government actually undertake some informed policies without having right kind of data, especially during the crisis situation? So I think Professor Deepak Nair, probably, he sent me a message that he has to leave. So probably we may not be able to get him back for the rest of the session, but I know that there are many participants who have been waiting, and actually they are listening to your presentation and speech. So if anyone wants to raise a few questions, please, it's your time now. Professor Rehan Soban is here, and he would like to respond, any question or comment. So please, very brief, if you want to.
As I said, because I have not had my dinner yet.
Okay, so I think it's already been late then.
But anyway, no, I'm happy to respond. So let's have some questions.
At least a couple of questions or comments.
Yeah. Okay.
Wants to take the lead? I'll take two comments.
Mm-hmm. Have we got any from from the countries who are your partners?
Sir, here is one. Okay, I can see Dr. Muhammad Ilyas. Would you like to say very quickly? And also, I'm not sure whether Dr. Abdullah Shibli is here, so he can also speak very quickly on that.
Okay, Salim.
Am I audible?
Dr. Shibli, you will come next. First, I will give the floor to Dr. Muhammad Ilyas.
Who is this?
So, am I audible?
Yes.
Who is speaking?
Yeah, I am Professor. I am Dr. Ilyas Hossain from Rajshahi University.
Yes.
So, thank you very much, sir, for your nice deliberations, and also I'm thanking Professor Nair as well. My question is a short question, because this second wave of COVID is different from the first wave. We can remember the last quarter of the 2020 fiscal year and this fiscal year, that last time we got COVID infections in the large cities, Dhaka, Chittagong, etc. And the rural economy was not much affected, although affected in the first quarter, but it recovered very soon and helped our economy to recover. But this year, we are having different experience, because the corona spike, we are having corona spike in the northwestern regions, especially I am in the Rajshahi region. And this time is very economically peak region, peak time for Rajshahi, because the mango economy and is now very much getting infected.
Thank you.
Deepak is back. But
Salim,
Deepak, we should keep you
I
very
need
long.
to leave now.
Yeah.
Salim, we are 20 minutes past our scheduled time. I lost the connection again. I must leave now. Please forgive me. I was about to send you an email message.
Of course. Thank you so much for being with us.
Yeah.
Thank you, Professor.
My apologies to everybody.
Okay, Deepak, love to Rohini.
Yeah, thank you. Thank you.
Okay, bye.
So can I continue?
Yeah. I think we got your question, Dr. Mahmood Ilyas. So
my question is, this time the regional various regions are getting affected, and the rural economy is much more affected than the urban economy. So, for example, the Rajshahi region is a mango trading region, and this is the peak time. So, with these infections and these effects in the rural area, can the recovery process of Bangladesh economy will be robust? This is my question.
Thank you.
Good point. Thank you. I don't have a real answer to that. In fact, I would wish to learn from you because we had no idea how severe the incidence was and what its macroeconomic outcome might be. This is something that you may look at, Salim.
Thank you, sir. Definitely. We are actually looking at trying to gather data as much as possible from the other end. Yes, we will be in touch.
We are still not getting our supply of Langra mangoes. I'm a great consumer of Langra mangoes.
Langra is coming. Langra is coming.
Yeah. All right.
Thank you. So we'll take the very final question from Dr. Abdullah Shibli. So Dr. Shibli, if you can be very brief. Thank you.
Okay, thank you so much.
Are you in London or where?
I'm in Boston, sir. I was a student of yours at Dhaka University, then taught there for 10 years, most of it on study leave. And then since then, I've been working in the United States and have been a big fan of yours.
No, I read your articles in our paper.
Oh, thank you so much. That is a big boost for me, and I will always appreciate your kind patronage. Let's put it simply. I would like to just make one simple comment because your observation on randomized control trials piqued my interest. I have been a big fan, and because I live in Boston, Cambridge, some of the gurus of randomized control trials live here, and I have found that it does work. It does give us results that are very difficult to otherwise pin down. And I put a comment there on my chat line, so maybe if you get time, you might be able to take a look. The other question I have, because I'm planning to go to Bangladesh within the next week or two, and one of the questions I have is about the spread and also the recovery of the economy. I would like to ask, maybe if you have a minute, comment on whether you think the impact of this wave of COVID spread will die down in the next month or so. And again, I'll be happy if you give us, even if a yes or no answer. Thank you.
Well, the answer in a way is that whilst there may be an impact, of colleague from Rajshahi is in fact made a perfectly valid point about the impact now being on the outlying districts and then moving into the rural economy. As far as the system is concerned, both in terms of the official response as well as in terms of the societal response, we all seem to be working on the assumption that the second phase is over, because everything is really opening up. In fact, offices are opening up, government offices are functioning. They are getting ready, I presume, at some point to open up the schools. I don't know whether they will open up the university. But whatever limitations are being imposed, a lot of these again are being ignored, and everything is really going back to normal. I mean, you really measure normalcy by the degrees of traffic jams in Dhaka city as to whether they are really approximating pre-COVID levels. And for some peculiar reason, I don't have any satisfactory answer. This answer seems to be yes. So question therefore is that the economy is attempting to respond and to revive and to pretend that the second wave is also sort of behind us now. Now, whether we will pay a price for this in terms of the transmission of infection rates, which may then rebound and again lead to further close downs, there is no way of saying. This remains, I mean, you will need both the sort of medical opinions as also the research opinions of what is actually happening in the outlying regions to get a response to this. But at the moment, we are really sitting here and praying to Allah that the recovery can go on, and hopefully the consequences of pretending that there is really no real problem will really not have too severe an impact.
Thank you, sir. I think it's already late and sir has his dinner time now, so I think we should not actually delay his dinner.
Well, all of you have to have dinner, I presume.
Thank you, Professor.
You are smart enough to have had it.
Well, thank you so much. We'll actually make a transcript of what sir said actually today. And it's already been recorded and it's all on our Facebook, and we'll post it on the YouTube channel too. And again, I must thank Professor Sobhan and Professor Deepak Nair. I think it's an excellent session, and we look forward to engaging with them in the future too. And with this, I'd like to invite you for tomorrow's sessions. You know, we have 3 more sessions tomorrow, the final day. And thank you once again for being with us in this conference. Thank you, sir. And
thank you, Salim. My one request to you is that you should try to get some feedback from the South Asian partners.
Sure.
From Poshraj, from Suleri, and from Dushni, in terms of the narratives that the two of us put on the table. How far do they actually reflect their story?
Of course, sir. I will definitely do that. Thank you, sir.
Okay. Thank you.
Thank you. Thank you, sir. Good night.
Good night.
Everyone, good night.